Welcome to the Swetland seminar. If you could please share your name and the organization you represent in the chat. So if you're not familiar with the Swetland Center, in the 1950s, David Swetland and Marion Swetland felt not enough was understood about the unintended health consequences of chemical, agriculture, and industrial products in our environment. So they focused the Marion Swetland's Professorship of Environmental Health Sciences on preventative medicine and the threats of man-made environmental hazards, so that all graduating doctors would have an interest in and understanding of the impact of the environment on human health. So today, the Swetland Center continues Marianne Swetland's legacy by building partnerships to find and scale solutions to redress the environment's disparate impact on low resource populations in Cleveland and beyond. And as research continues to demonstrate the vital connection between the environment and health, our center is positioned to respond. And our mission is to study the complex interplay between environmental determinants and population health outcomes. So we place special emphasis on community-engaged approaches that address the role of structural racism in creating and sustaining environmental health inequities. And we seek to translate these findings into policies, practices, and relationships that promote community and population health equity. And these are our values here. And you can also read more about us on our website. I'll put some links in the chat as well. And if you're interested, our website is case.edu/Swetland, or you can also email us at swetlandcenter@case.edu. And our next Swetland seminar will be next month on Tuesday, May 21st from 9 to 10 a.m. on Zoom. And the presentation will be from the Nutrition Equity Fund of the Nourishing Power Study. And it's going to be a panel discussion, early learnings from the development of a community-advised funding model. So we hope to have Lindsay Lott, Sean Brown, and Tanisha Velez, and there may be another speaker as well on that panel. So you can either scan this QR code that's on your screen or copy and paste that link there. I'm also going to post this in the chat too. And you can find the registration on our website as well. So we hope to see you there. And I will turn it over to our director, Darcy, for introducing today's speakers.
Well, good morning, everybody. And this is a really special seminar because we're working with partners who've been involved in some of the prior research of the center that actually led to the Nourishing Power Network study. So I'm very pleased to introduce our two speakers. Dr. Jill Clark is an associate professor at the John Glenn College of Public Affairs at The Ohio State University. Jill's research is focused on agri-food system policy and planning, centering on community and state governance of food systems and public engagement. Jill provides statewide leadership as a steering committee member of the Ohio Food Policy Network, international leadership as the past president of the Agriculture, Food, and Human Values Society, and local leadership as an appointed member of the City and County Local Food Board. Jill recently was awarded the 2022 Excellence in Engaged Scholarship from the Engaged Scholarship Consortium. We also have Katie Merritt, who is a fourth-year undergraduate student at Case Western Reserve University studying economics and nutrition. After graduation, Katie will work as a research assistant at the Federal Reserve Board of Governors in Washington, D.C. Katie's work includes internships in economic development with Jobs Ohio and food and agriculture consulting with Aimpoint Research. At Case Western, she is a co-founder and senior editor of the Case Western Reserve University Journal of Economics and works as a TA for the economics department. And I just want to say that we met Katie during COVID when all of us had to figure out what the heck we would do when students couldn't come to campus and were working remotely, taking classes in their hometown. And Katie is from Columbus. And I'm really just pleased to see how that unusual circumstance resulted in such an amazing collaboration on the research that you'll hear today. So without further ado, welcome Jill and Katie, and we're excited to hear your presentation. If you have a question, feel free to add it in the chat as you go, but we will have a Q&A time at the end of the session.
Thank you so much, Darcy. And thanks to the Swetland Center just overall for, partnerships and the invitation. And we're really excited to tell you all about some work that we've done, and you can see that Darcy is also a part of this. We'll bring her in the Q&A. So really just want to pose a question to you all that's pretty common. This is a pretty common question in the broader food movement. Can you solve problems related to the food system within that same system? So food insecurity, environmental degradation, diet-related diseases, the demise of the family farm. Can you solve those things while working within that same system? But so this is just to kind of set up what we've been thinking about and what was motivating this study. But before we move any further, I want to get a sense from you all. How familiar are you with the food system? So we're going to launch a poll here, and if you could weigh in on that, that'd be great. Yeah, I see some. All right, so I noticed some names on of those folks coming in, and so no surprise that there is greater level of familiarity. I'm gonna maybe we can end the poll and just show the results there. Great. All right. So some level of familiarity that saves us a little time. So I will not spend too much time on this next slide, but it's always good to kind of ground us back into, what do we mean by the food system? It, of course, involves the supply chain, getting food from farm to plate. But think about all those other interconnected resources, activities, and actors that drive that supply chain. I noticed folks, for instance, from public health, right? Our public health agencies are very much related to the food system. Governments who create the rules, retailers who sell inputs into, agricultural inputs. And if we start to draw the connections between all those actors and activities and resources to the supply chain, we might get something that looks like this, right? Like very kind of an interconnected web of activity. We think about people who write about food movements and the food system. I'm reminded of Eric Holt Jimenez, who wrote about the differences between different efforts to change the food system. And he makes the argument that you can't change inequity in the food system by tinkering around within that current system, that you need to think about working outside of the system. And I highly recommend his book. If you haven't seen it, it's or I can email you just a separate article that he wrote that kind of lays out some of these concepts. And so I am going to cover just a couple of concepts here that he covers and the way that he thinks about them in terms of systems, because I think it's going to be helpful as we move forward today. So, anti-hunger. Think about like emergency feeding, food banks, food pantries, programs like our Supplemental Nutrition Assistance Program, or what's commonly called food stamps, women, infants, and children. These are activities that are part of the current system. And his argument is they'll play within the current system, but they'll maybe reinforce it, not transform the system. Social enterprises. Organizations that use business-like strategies to address social issues such as like homelessness and racial inequity, unemployment, health disparities. They may be for-profits, they may be non-profits. A for-profit, maybe about Tom's Shoes. You buy a pair of shoes, they donate a pair of shoes. Profit maximization through price decisions isn't the main goal of that social enterprise or any social enterprise. Social interests are a part of business decision-making. But you can also have nonprofit social enterprises. And I think here about our food bank in Columbus that has a pay-as-you-go restaurant that generates income, but the profits are reinvested in the business. And while relatively new, social enterprises work within that same market system of like supply and demand. And so Eric would say that this is still working within the same system. And then you have the concept of food justice. About addressing inequities in the food system, because all those problems I listed earlier, we know that racialized groups experience those problems far more in our society. And so food justice is a direct response to past discriminatory policies. So, think redlining, or when the USDA systematically denied Black farmers loans. And so in some ways, food justice is about righting the wrongs or demanding rights in the current system. And then food sovereignty. Academic authors make a very clear distinction between justice and sovereignty. Food sovereignty is overtly opposed to global businesses and the ideology that kind of dominates the global food system. You know, as a movement, food sovereignty was popularized in the 90s by La Via Campesina, which is a peasant movement in the global South. And this movement seeks to secure rights of communities around the world to define their own food and agricultural systems. Instead of asking for rights within the system, they want to create a system that's of their own making, for them, by them. All these concepts, all four of these concepts showed up in a project that some of you are familiar with, Food Nest 2.0. Darcy Freeman was the PI, or who led the team. I was a co-PI here in Columbus. And the first author on the paper, Katie, was our research assistant, as Darcy mentioned earlier. She joined us during COVID. And I saw Miss Marilyn, she was a part of this. And we had a team of 10 university and about 20 community research members. And we drew a model of the food system, you know, as I was showing before, all those connections, right, that aim to realize nutrition equity as an aspirational goal around freedom, agency, and dignity in food traditions, resulting in people and communities being healthy in mind, body, and spirit. So despite the academic debates, this team identified social enterprises as a solution and a mechanism of change to address inequity in the food system. Social enterprises were connected to anti-hunger initiatives and food justice and food sovereignty. And to go further, there was really no meaningful distinction between food justice and food sovereignty that was important to our team. That's not to say that all of these terms meant the same thing. They were just connected by the same mechanisms, which gave rise to this study. But before we get into the actual study, I want to give a little bit more background. So to talk about how we got started. So how does one go about drawing the food system? Because if you look at this menu of actions for driving community change, it was a result of us spending 3 years drawing out the food system and really revealing what we thought was driving conditions that we were experiencing then. And so we started by having this conversation about what do we want to see more of and what do we want to see less of? And on the left here, you'll see, you know, we want to see more of healthy neighborhoods with good food access, community engagement, public art, right? We want to see less of unhealthy food. And so we started to do these exercises, brainstorming pieces of the food system or variables, you know, that vary over time and have relationships with one another. And we started telling stories about what we'd like to see over time, our hopes and our fears. And we can start to name like all the kind of pieces that would, and parts of the supply chain that produce our hopes and fears, or the other things that impact that supply chain. But before we move on, another poll for you, because one of a causal loop diagramming is the way we went about doing this. And so I want to get your familiarity with causal loop diagrams before we move on. So if you could weigh in on this next poll, that would be great. All right. Okay, so I'm seeing we've got a good portion of folks that are pretty familiar, and seeing some of the names on the list today, I would expect that, and some who are somewhat familiar. Okay. All right, and if we could go ahead and close that poll and share the results. All right, so this will save me a little time here too. But I will spend a moment for those of you who said you were slightly familiar or somewhat familiar. All right, so you know, if we think about healthy food, so that the hopes and fears around healthy and unhealthy food, we could start to kind of put in sentences the relationships between some of these things. And so we can think about demand and supply, right, which are pretty basic concepts, you know, as far as like availability, like are things available, do people want them? So as a demand for healthy food in the neighborhood increases, then the supply would increase. Okay, and as demand increases for healthy food, then the demand for unhealthy food would decrease, right? As one goes up, the other would go down. As demand for unhealthy food decreases, what's going to happen to the supply? The supply is going to go down. And so we would do these exercises and take our hopes and fears and start to turn these sentences, right? These relationships into causal loop models. And I'm just going to show you a really simple one. This is obviously not a full tutorial, but we've got all 4 variables here: supply and demand of healthy food, supply and demand of unhealthy food. You can see these feedback loops, right? So the positive relationships, things are moving together. They're either both increasing at the same time or both decreasing. Negative relationships, one's decreasing, one's increasing. They're moving in opposite directions. So let's play around. Let's just increase this one variable and see what happens when we increase the demand for healthy food, which was the exercise I was going through earlier. Okay, well, we can see that, pretty soon we would have a good supply and demand of healthy food. But we know that it isn't that simple. If it was just about supply and demand, we would have solved healthy food access a long time ago. And so there's lots of other variables, and this is where our team landed. So, you can see there's a lot more involved here. And, system thinking kind of helps us to see how everything's connected. And you can start to think about, well, how might you make change? Because Eric was talking about how the food movement makes change. You can think about how you might make change here. Like, are you going in and are you adjusting one of those variables, if you will? Like, let's see, are you going in and doing fair access to land? Are you increasing it or decreasing it? But then there's changes that you can make that would be between the relationship between variables, right? Then if you're in Eric Holt Jimenez's headspace, you think about changing the rules that govern this entire system. Like the difference between increasing access, right, through a variable or relationships versus saying everyone has a right to food. That would change everything we see here. And the point isn't for you to read this model, but just to see this is the activities that we were doing that resulted in us mapping out what ended up like being 3 basic domains to the food system. And they're kind of an anti-hunger approach, working with local markets, like supply demand, and then food justice and sovereignty. And these are the concepts I mentioned earlier that are supposed to be these like very distinct, at least in academia, but they're all showing up and they're all related in our model. And so you can start to like trace through some of these and see those connections and how something like being engaged in policy, right, is related to stores offering more healthy food, but then it's also related to things that we would associate with empowerment and having a healthy mind, body, and spirit, and gaining more equity through the food system. And so the fact that those 3 were all related was something that we were like keenly interested. How is it possible that we have social enterprises as something in our model related to all those 3 domains, which led us to our research question here. And I'll pass it on over to Katie.
Yeah, thank you. So this led us to our research question. We wanted to explore how have social enterprises been implemented in the food system to further food justice and food sovereignty, and how has that worked out in practice? So our specific research question: how do social enterprises interact with food justice and food sovereignty movements and their visions to realize more democratic and equitable local food systems in communities? And so to get started, we wanted to conceptualize what was already existing. As with most research questions, there was quite a bit of literature on one of our variables, our social enterprises, and then there was a lot on the other side of food sovereignty and food justice separated. But what we wanted to explore was this intersection between all of the concepts, where we're looking at social enterprises actually applied to the food system to further sovereignty and justice. So to get at that intersection on the Venn diagram, we brainstormed these concepts, these 4 concepts, to develop search terms in order to find research that's been done on these social enterprises applied to the food system. So our first concept was getting at the goal, so the ideal vision, sovereignty, justice, democratic food systems. Our second concept was how are we going to achieve the ideal? And in these articles, we were looking for those that did it through market-based activities such as social enterprise, social entrepreneurs. These are some different terms we looked for whom and who is doing it. We were looking for community level in urban environments. And then we wanted to look at contexts either in the US or relevant to the US, because that's what that was the context of the larger project. And so we followed the PRISMA guidelines for a systematic review. I can talk more about this in the question and answer if anyone's interested, but basically we went through a selection process where we were looking for empirical studies, so real world, looking at an actual example, not like what's theoretically going to happen, about social enterprises applied in the food system, like I've been saying, to food justice, or with the goal of food justice or food sovereignty, and we were looking in the US or similar context. And we only included peer-reviewed literature and dissertations in our selection process, which is important to note, and we'll talk about that at the end. So after we narrowed down the articles, we ended with 9 total. And in the 9 articles, there were 17 examples of social enterprises. And so this slide shows you kind of the geographic areas of all of the enterprises in our article. We had representation from France, Oregon, Wisconsin, Vermont, California, and Louisiana in the United States. And then we also had a few examples from Melbourne, Australia. And so I have the author of the paper where the social enterprise was included, and then the N indicates how many social enterprises we had from each article in that geography. So next, we want to just give you an idea of some of these social enterprises that were in the articles to kind of bring life to them. So the first one here is Red Bay Coffee. This was in Oakland, This one is in Oakland, California, in the Alkin article that we read. And this was a for-profit coffee shop that sought to provide living wages to its employees. And you'll hear more about that one later. Next is Planting Justice. This one is also in Oakland, California, from Alkin. And this one employs formerly incarcerated individuals. Previously, at the time of the study, they provided a landscaping service where their employees would go help urban consumers develop urban farms, and that was how they generated market income. It seems that that market activity has now been shifted, has been discontinued, but at the time of the article, that was something they were talking about. Next, we have the Center for Education and Research in Environmental Strategies in Melbourne, Australia, SARAS for short. And this was in Laidlaw and McGee's article. This was a not-for-profit umbrella organization, but they had market activities within the not-for-profit. And so their services include a food box delivery service, and then they also had aquaponics, so combining agriculture and fish production. And then lastly, we have the Village Market. This was in Portland, Oregon, in Waddell 2016's article. And so this was a grocery store that it is a grocery store that sought to replace or provide a healthier alternative to a corner store and increase preferences for healthy food in their community. This was an example of one that offered different prices based on a consumer's ability to pay. And so that's something we'll talk about later, but they had some products or some customers that would pay full price for the items, and then that would allow them to offer a discounted price for customers that might not be able to pay the full price. So With all these examples being said, we're curious if you're familiar with any food sector social enterprises in your own area, if these made you think of anything you're familiar with, or if you were already familiar with some enterprises. All right, yeah, so it looks like, yeah, people have a few examples in Cleveland and Columbus. You can keep typing them in the chat and maybe look up the suggestions other people have to go support. So yeah, it seems like we're familiar with some in our community. So once we had these articles, these 9 articles with the 17 examples, I'm going to walk you briefly through the way we collected data from the articles. So first, we started with initial data extraction. We just wanted to know basic information about the paper. Where was the geographical focus? How many social enterprises were included? Also, how did the article define the concepts of social enterprise, food justice, and food sovereignty? We then moved into our data extraction process through 2 domains of coding. So the first domain, we wanted to look at characteristics of the social enterprise in the food sector. So like, I'll go into it more in detail, but like, what was their market activity? What was their business model? Who did they employ? Who owned the social enterprise? So for these ones, we determined the criteria beforehand and then collected the data. And for this one, we were interested in frequency, like how many social enterprises are we seeing that are a for-profit model versus a nonprofit that has a market activity, that kind of thing. Versus domain 2, this was our second stage. This was the tensions and contradictions that we started to see between social enterprise and these ideas of sovereignty and justice as we're reading the articles. So this was more inductively determined, like as we were moving through the process, we started seeing these ideas of how the relationship actually looks in practice. So for here, we weren't exactly looking for frequency, we were just noting these contradictions as they arose, and then like synthesized all the data and made our conclusions based on this. So first is we were looking at the common goals of food justice and food sovereignty as it was defined in our articles. And here we see that, as we were saying earlier, there's not a huge distinction between justice and sovereignty in practice, like in these empirical studies. We're seeing some commonality of providing an alternative to the conventional food system. For justice, there's more of a emphasis on social justice and creating opportunity, economic opportunity, but overall, they're not contradictory to each other. They have a lot of similarities. Next is how our articles defined social enterprise. So we saw that a lot of them defined enterprise as an institute or a business that prioritizes community employment. Maybe it tries to decrease reliance on grants and donations to fund the business versus like the charitable food sector that's always relying on grants. Also combining economic and social value creation. So next we'll go into these domain 1 codes. Again, the characteristics of the social enterprises that we studied. So I'll go into each in detail, but you can see a list of the different codes that I'll be going through. So first, the explicit goals of the social enterprise. So what did the social enterprise state that they sought to do? What was their social goal? Most common was facilitating community education and engagement, but there was lots of other goals. There was even more that I don't have listed here. Another one was providing community employment opportunities. In terms of business model, we see that some of them are affiliated with larger nonprofits or existing organizations. One of the ones I gave an example of was like that, where there's like a large umbrella nonprofit, and then the nonprofit uses market activities to generate income. But we also see standalone social enterprises where it's such as the Red Bay Coffee Shop, where it's its own business, it's a restaurant, and it just has market, or it generates market income, and then it has a social goal. We see actually notably only one was worker owned. That we thought was an interesting finding. Next is the market activity of the social enterprise. So how are they making money? It was pretty distributed. There was a variety of activities. We see that some, the enterprise itself is producers, and they're growing food, maybe in urban farm environments, and then they're directly distributing it to consumers or local businesses. We also see groceries, such as the village market that I showed. Some provided educational activities, catering, restaurants. The landscape service was planting justice. And then in terms of ownership and employees, so this was an interesting one. We saw that only 5 of the examples prioritized the employment of community members and beneficiaries. Beneficiaries are the individuals with the direct stake in equitable change. So yeah, we saw 5 examples of this, and then only 3 examples where the social enterprise was actually owned by the beneficiaries themselves. And so notably here, there was actually 2 articles with 7 total examples of social enterprises that didn't even address who owned the enterprise or who was employed by it. So that was another interesting finding, that that's something that articles don't necessarily even tell us about the enterprise, so didn't see as important. To continue with domain 1 codes, the target customers of the social enterprise. So we see that some of the enterprises target high income consumers that can pay higher prices. So they would tailor their product to these higher income customers. We see that some of them provide a different price based on a customer's ability to pay. So the village market is an example of that, the one that I mentioned earlier. And then we see that some of the enterprises specifically focus on lower income customers, and they're trying to increase affordability and access. In terms of challenges, the enterprises face a lot of challenges. So some of them are related to things that they can control, such as business model, financial sustainability. But then some of them are more external challenges, such as gentrification, which I'll explain more later, and then also like competitive forces in the industry that they're in that can make financial sustainability difficult. So now we're going to move on to the domain 2 codes, which again, these were looking at how social enterprises interacted with these justice and sovereignty movements in practice. So were they actually realizing the goals that they sought to achieve? So the first one I want to talk about is the intention of the social enterprise versus the outcome. We saw some tension here, or potential like incompatibility. So for example, in Oakland, California, in the Alkin article examples, so Red Bay Coffee was one of these, Planting Justice was another of them. We see that there's a potential for these green social enterprises, as in social enterprises that are environmentally conscious, promoting healthy foods and lifestyles, maybe using organic and local terminology, that they can actually contribute to green gentrification, because these green food cultures can be seen as a signal for more wealthy residents to come into a city. And it's been shown to raise property values. Like if a coffee shop enters an area and it has this green branding, it's been shown to raise property values and then drive displacement of longtime residents. So this is a contradiction that we found in the literature. And then another one we found was that social enterprises can perpetuate stereotypes of food preferences based on income. So for example, in some of the social enterprises, they used these organic, healthy, local, artisan type foods to attract wealthier clientele. So if you had a social enterprise that was trying to attract high income customers, they would use this branding. And so that kind of perpetuates the stereotype that only higher income customers would prefer these foods, rather than making these foods accessible to all customers. And this is really a goal of food justice, is to make these alternative food systems accessible for all people. And then second is about examining social enterprises in isolation versus as part of a larger movement. So how effective are social enterprises as a market-based strategy for furthering sovereignty and justice? And so we find that some of them were successful, but some of them were unable to prevent the displacement of their employees despite providing living wages. So we see this in the Red Bay Coffee Company. They provide living wages, and that's a huge part of their social goal, but they still found that some of their employees had to leave the area because they couldn't make rent, or they were still living in their cars, even though they were being provided this living wage. And so that suggests that even though the social enterprise is doing what they can to provide a living wage, they weren't able to transform the actual, or they weren't able to transform the situation and realize justice or sovereignty. But then some articles argue that social enterprises can motivate change on a scale larger than themselves. So we see one in Melbourne, Australia, where it was a small experimental social enterprise, like a small producer. And the argument here was that if you have a lot of small scale social enterprises, maybe experimental, trying new things, they can help motivate change on a scale larger than themselves. But overall, we see in the articles that there's an acknowledgement that social enterprises alone can't make the change by themselves, and the work of social enterprises needs to be coupled with advocacy. So after going through our findings, we come back to our question: are social enterprises, food sovereignty, and food justice strange bedfellows or systemic supports? And so overall, we're finding that in practice, there's evidence of compatible and incompatible interactions between social enterprise, food sovereignty, and food justice. The potential compatible interactions include supporting community agency, increasing employment, raising marginalized voices. But it's important to understand that there is potential for these incompatible interactions. And that's not to say we shouldn't have social enterprises for the food system, but it's just something to consider for the social enterprises as they develop. So we see that there's a limited ability of social enterprises to address larger issues like education and training of community members. And then also there's a potential for stigmas against marginalized groups to be perpetuated. And then again, the threat of green gentrification, as I mentioned. Sorry, was there a question? Okay. And then my last takeaway here is that for these compatible and incompatible interactions, we identified 4 empirical characteristics of the social enterprise that we find determine how compatible or incompatible they might be with the goals of social or food sovereignty and food justice. So first is ownership and employee demographics. We find that when the social enterprise is owned and or employed by beneficiaries, it's more effective in furthering the goals of justice and sovereignty. For example, for green gentrification, we find that even if the business is going to be bringing in wealthier individuals to the neighborhood and like attracting wealthier people to the business, then it should be employed. It should be staffed and owned by beneficiaries to best help build community wealth. And then we also see that business model is important. How self-sustainable is the social enterprise? Additionally, the aspect of the food system targeted, so the market activity of the social enterprise. We see that some activities are more successful than others. So for example, the village market, the grocery store, we see that that one had trouble competing with existing grocery stores just because of the nature of that industry. Because the big grocery stores have economies of scale and they have so much inventory, they can sell it at a low price. But we see that the social enterprise, the village market, had trouble competing with those prices in their own enterprise because they just didn't have the scale. So the aspect or the market activity can determine how successful an enterprise is in generating market income and being sustainable. And then another empirical characteristic is the target customer base of the enterprise. This can determine how the enterprise is either furthering stereotypes of preferences based on income, or how it's kind of challenging that or making the alternative food system accessible for all people.
All right, so to kind of bring this home, systems thinking allows us to consider how social enterprises and concepts like food justice and food sovereignty all exist within society simultaneously, right? Our society, whether we like it or not, is market-based, and this means that markets, such as those with social enterprises, exist within the same sets of relationships as these other things like anti-hunger. But it suggests that if they all are coexisting, that there might be levers of change. Although, as Katie pointed out, thinking about kind of unintended consequences and feedbacks around, for instance, green gentrification and reinforcing elitism is something to attend to as we think about kind of how we want to make change. And I have to credit, I think it was Darcy who always has us talking about thinking about a both and approach. People need to eat today, right? But we could think about how empowerment can be found within the broader system while addressing today's needs. Social enterprises alone are not going to shift us into a state of justice or equity or sovereignty, but they can contribute to a more democratic and equitable process or equitable food system if we start to ask the questions like for whom, by whom, and with whom. Centering social enterprises on things like community assets and community leaderships are more likely going to transform the food system. So, finally, we were only looking at the peer-reviewed research. We were not looking outside of that. And so that's a limitation because we know that in practice, there are plenty of social enterprises that we could be looking at. But what's interesting is that, these academics spend all their time talking about how these things don't exist together or how we must consider these concepts as really separate. And yet there's not a lot of literature dedicated in academia to talking about kind of what they look like in practice. And we find that water very muddy, as you can see, given their coexistence. And I think it starts us on a good conversation for future research, which Katie talked a little bit about some things to really explore, like ownership and employee demographics and the kind of business model and the target customer base, but also, maybe validating some of these models that we're doing to really understand the empirical relationship or the actual relationship between these concepts. So with that, we do have some thank yous and we'll open up to questions. I noticed there were some questions that were in the chat earlier, and I'll stop sharing my screen so we can see each other. There we go. All right. I guess there's been some questions about how we define healthy food in the chat. And I'm going to invite Darcy to join in the Q&A as well. And I think she's up there at the Swetland Center, Brady Bunch box, as I think of them. Yeah, Marilyn.
Oh, yes. Good morning, everyone. I'm just been sitting here biting at breath trying to ask this question because I know that it's about research. And so in this research, and we come up with these answers or suggestion or what have you, and do you pass this research on to the powers that be so that we can see this change in reality? Because, earlier, Jill, you talked about, touched a little bit upon redlining. Well, we all know today that redlining is illegal, but however, it's dressed in such a way that it's still going on. Perfect example, these government programs that they have for people. They always ask that, what's your zip code? And according to your zip code, they categorize you and herd you together in certain areas to shop. If this was feasible and you're giving this out and allowing a person to have this card, why don't they have the option to change? But this starts with policy, right? So your research and how is all this connected to start to make a change in what we see in our communities?
Miss Merrill, that's a great question, and I think if and I'll open it up to my fellow colleagues here. You know, so research is embedded in this broader set of activities that we try to do to impact change, right? Part of it is being able to come forward with something to change a conversation. And so you brought up redlining, for example. The Kirwan Institute has done, this is at Ohio State, has done some marvelous work around redlining that started to change the conversation about the impacts of redlining. You know, our project is, as you know, Ms. Marilyn, was really about identifying what nutrition equity meant to our team, you know, broadly. And then that menu of actions, if you remember, was kind of how we want to go about doing it. And that rollout then has been through the fellowship program and the nutrition equity partners. But I'm going to stop because I'd love for Darcy to jump in and talk a little bit about that transition from, you know, we spent all those years kind of developing these models and trying to come to a shared understanding of what was happening in the first place. And then Darcy can talk a little bit about, you know, where that's been taken with the center.
Yeah, thank you, Jill. You know, one of the things that stood out to me as you were presenting this work was in your summary at the end that social enterprise alone cannot change. It must be coupled with advocacy. And so the next phase of the modeling study is the Nourishing Power Network. And we were really tasked by the partners like Miss Marilyn and others to say, hey, we like your research, but we want to see action, right? So what does this look like in the real world? And Nourishing Power Network was our approach to think about action. And to get at Selena's question about healthy food access, or what is healthy food, similarly, when we think about what does it mean to change the system, there isn't one answer, right? There's not one thing that we can do. There's not 3 things we can do. There's not 10 things we can do. That's going to vary depending on who we're working with, where we're working, with whom, by whom, how, et cetera, all the things that came out here today. And so as we thought about Nourishing Power Network, we really focused on what is the infrastructure that allows community to drive and define change. And, you know, our 4 parts of Nourishing Power Network, we have a fellowship component where we're investing in fresh ideas. So local leaders coming with their ideas, how do we add strength to the existing asset and hopefully bring those to life? We have a fund that we invest in community action around food justice. We have networking where we connect and build relationships. And then we have a nutrition equity fund or an advisory council that guides and informs the work. And one thing that I think is really interesting is, and that's an adaptive study approach. Like as we learn, we change what we're doing. So our current advisory council has 2 areas of focus, and one of them is on the Nutrition Equity Fund. How do we invest in community-driven food justice work? And the second is around policy action. And realizing that though, like I think this is like the connection between research and action. It's really helpful to see that where we landed based on working with community members, really very much driven by community partners, is what you're saying we should be doing, which is super cool of synergy around these ideas. So I think that is, now how do we do that? That's still really hard. And I think to your point, Selena, about these definitions, a lot of what we're talking about, community wealth building through the food system, these concepts go over most local policymakers' heads. They have no idea what we're talking about. It is not legible. If you said, how do we work with the food bank to get more pantries in the neighborhood, every policymaker in our city could sit at the table and know what we're talking about. And so some of what we're dealing with in this work is creating language that allows these policymakers to engage, because we are not talking about something they understand. And maybe they do and they're explicitly against it. And that, I'm sure there are people like that. But I think there's also people that do not understand what we're saying. And so the easy answer is to invest in the system as it is, right? And so how do we help them see that there's another way? And that's been a challenge for us. And even within Nourishing Power Network, of thinking about how do we create a marketing strategy that helps people understand that, number one, food systems change that does not result in wealth building for the communities most disaffected by the food system as is not good, right? But that is just, that's something we're still trying to figure out. So I'll end by saying definition of healthy food. When we wrote the paper, the results of the modeling study, we defined it as nutrition equity. That of culturally relevant food that leads to healthy body, healthy mind, healthy spirit. Miss Marilyn, you could talk more about that. We did not say food equity. And that was because our partners really believe that it's not about any food, it's really about food that feeds the body, mind, and spirit. But we did not go farther than that to say it's this box of food or that box of food. That we felt like those are conversations that need to be had in community. But in the end, nutrition equity is about foods that feed body, mind, and spirit. I want to turn it over to Miss Marilyn. You might be able to offer more about how we think about healthy food in that framework.
Right, exactly. And that was part when I got my fellowship, that was what I was speaking of. Everybody was talking about eating healthy food, eat salads, eat this and eat that. And that's a wonderful thing to put in your body, right? We all require certain nutrients that come from those certain types of food. But what we have failed to realize that we have to feed our spirit as well. And what I'm saying is that one goes hand in hand with the other. If you are not feeling good about yourself inside, then you're not either going to eat, you're going to overeat, or you're going to eat unhealthy, right? So let's start thinking about, when I talk about fruits of the spirit, I'm talking about love. That's the number one thing on the list of things: love and kindness and feeding each other, those type of things, so we can empower and encourage each other to be healthy spiritually. And that spiritual bond between eating healthy is such an amazing thing, because then your mindset starts to change. Well, maybe I shouldn't do this and put in my body, because now I'm feeling better about myself. So when I did my fellowship, and I want everybody to think about, as your research and as you continue your work around this, think about the person, the human aspect first. And then we can it sort of has that domino effect on creating other positive things that we can do to feed ourselves. And we have to do that in our research. We have to do that in our communities and neighborhoods, because so many of us that have been under redlining, that has taken on this domino effect, still have that mindset. So we have to concentrate too on feeding each other positive things, telling your neighbor, telling the person that you love them, not only saying that, but showing it in action. And I guarantee, because I do it in practice all the time, I guarantee that you will see that change. So thanks, Darcy, for allowing me that time. Thank you.
That was beautiful, Miss Marilyn, and really speaks to the reluctance to somehow impose some sort of outside definition of what healthy food is on others, and rather seek for like self-determination and community determination with your loved ones of what feeds your mind, body, and spirit. So thank you for that. You said it so well. Selena, you have your hand up.
So none of you have actually answered my question. I appreciate all that you're saying, and I can understand what you're saying. And with those great explanations, I have a greater understanding of your meaning about what it means to have healthy food and how you're defining it. But now you see, all three of you have given me a completely different definition. And yes, they coincide. I want to really, let's look back at like historically in ways in which food has been used to oppress people, the way in which words like healthy food are used to demonize people and tell them that they should fit a certain look, should eat a certain diet, and otherwise to uphold tenets of white supremacy. So I think it's very important to define the words that you are using and the metrics that you are doing in any scientific study to resolve any possibility for ambiguity relating to your definitions. The reason I'm asking this is I could say, oh, yes, our goal is for a healthy food that fills mind, body, and spirit. Okay, great. Well, my elected official can decide their definition of healthy food doesn't coincide with that. They can decide their definition of healthy food means food made by this company, food that's only organic, food that's only this or that. And I think that ambiguity is very important to quash immediately because, it helps us all stay on the same page. And so when I'm asking this, it's a very important question because it doesn't tell me what you are going towards, what you are working towards, unless you can clearly define what that is. And so I know this isn't quite a question anymore, but I really implore you to examine that and think about maybe defining that in a very public way, how you're using that word and what it means for this work, because we all have a hand in, I think we all have kind of an understanding in the work we're trying to do here in the community. But again, if our legislators and if the public at large aren't familiar with terms and aren't familiar with how we're using them, that creates a recipe for disaster. And so, thank you. Sorry.
Thanks, Lena. And I hear, and I think maybe what we're having is, maybe there's something more there's something deeper that we're trying to get at, which is self-determination and community determination in what feeds the mind, body, and spirit, rather than, again, some sort of like outside definition. And so more interest in food justice and food sovereignty as defined by community, rather than trying to make that definition. Because I hear you as a researcher, I'm all about precision. But I think that the aim really was something deeper about people's lived experience in the food system. And I don't know if Katie or Darcy, you want to jump in on what Selena had to share.
Yeah, I agree with you, Jill, that this is I think what I hear from Selena, and I think is part of the broader narrative of the work, is that this is a conversation that needs to be had that is not only an academic conversation, right? I think in the spirit of the work that we're putting forth, this is a community conversation, and that there are ways to eat healthy that are going to vary across community. And so even in the menu of actions, when we wrote that at first, we called it menu of solutions. And our community partner said, solutions for whom? How do we even know these would be solutions for my community? And so we changed it to menu of actions. And I think it's in a similar spirit that this is absolutely 100%. I agree with you, Selena, that there should be a community conversation, and academics could be a part of that. But I think part of our interest is, like, in our work here, is to say we can't be the ones to define, other than to say, does it lead to healthy body, mind, and spirit? But I totally hear you that could lead to challenges by not being explicit. And that's a tension, right? That's another both and space, right? So go ahead, Ms. Marilyn.
I have to chime in on this, and I get what Selena is saying too, and I get so frustrated, but you know what? It is a conversation too that most definitely has to be held in the community, in our neighborhoods. But when we're with academics, it's there as well. But when we're sitting at these tables and make it, what's so frustrating, I see this firsthand every time. Residents, our community that this is affecting, get disengaged and discouraged because they don't understand the process. And when you go before policymakers, they want to hear a certain lingo that you use. So if you're coming to residents who are living in a certain area that these things are happening to, they don't know how to put that lingo together for policymakers to present it to. And of course, you know, policy takes a long time. Remember, I was on that food policy thing with you guys, and policy change takes a long time. But neighborhood and resident people do not understand that process. So they choose to back away from that table. So what we have to do as community resident activists in our neighborhoods, we have to try to work on the mindset of our residents if we want to come to some sort of resolution and learn how to work on these policies and how to make things change. Because as it stands, we're drowning. I gotta just put it on the table. We are drowning.
Yeah, Ms. Maryland, this policy change takes a long time, as you point out, and just reflecting on what Selena shared, you know, and what Darcy shared, it's also a part of like us changing the conversation, because that is agenda setting. Just a technical point back to Selena, for our study, we let authors define their own food sovereignty and food justice in their articles. Like, so that was something that Katie did, was look across a definition. So we weren't superimposing any definition. So we didn't have a working definition. We took definitions from people themselves in practice, not a superimposed one. But I'm seeing that we are at time. And so I'm going to throw it back to the Swetland Center.
Thank you all so much for presenting today. We will be sharing out the slides with everybody, and we're also recording this. So we're going to post it on our YouTube channel, which we'll be sharing later this week. So be on the lookout for an email with all that info. So thank you all so much.